Good afternoon. I'm Dr. Jazz Atwal, Deputy Chief Provincial Public Health Officer for Manitoba. Today, there are 2 additional deaths due to COVID-19. I want to offer my condolences to their families, friends, and loved ones. The current 5-day COVID-19 test positivity rate is 10.6% provincially and 11% in Winnipeg. As of 9:30 a.m. today, 223 new cases of the virus have been identified, and the total number of lab-confirmed cases in Manitoba is 53,872. Today, I have some updated modeling to share with you. Please put up slide number 1. Our case numbers are headed in a good direction, and our vaccination rates are increasing. But we continue to see strain on our healthcare system, and we continue to transfer patients out of the province for care. The data presented today was taken from the model earlier this week on June 8th, and the model has projections until the end of summer. This slide here shows the daily number of tests have decreased and are now below the lower limit of the projected range. Such a decrease is likely related to less circulating virus because of our restrictions, and more importantly, the adherence to the restrictions by everyone. When moving into the future, when no actual data is available, the model assumes a constant number of tests that align with the lab test volumes available in the data. It is important we continue to stay home when sick and go for testing and self-isolate along with your household until your test result comes back. Next slide, please. This slide here shows case levels and projections. Right now, the model is showing our case numbers are following the moderate or gray projections in the top left corner of the slide. They are below the projections for the uncontrolled or red scenario in the bottom right and the extreme or purple scenario in the top right of the slide. This indicates the restrictions have been in place and the adherence to those restrictions by the public have helped reduce the spread of the virus in Manitoba. And this is why we have been able to begin easing restrictions and looking at charting a path to reopening. Next slide. This slide here talks about the incident number of hospitalizations or new hospitalizations per day. Despite decreases in case numbers over the past week, a high volume of severe outcomes in Manitoba will continue over the next couple of weeks as both COVID-19 case counts and test positivity are still high. And severe outcomes tend to occur 1 to 2 weeks after diagnosis. At this time, data on the virtual COVID-19 outpatient program is not included in these scenarios, but will be included in the model in the future. This program prevents people from being admitted to hospital, but they are closely monitored at home by medical personnel, and at present there are 43 people in the program, of which 31 are on oxygen. The daily number of hospitalizations is still following the moderate to severe scenario. It is important to remember there is usually a lag between diagnosing a case and it showing up in hospital, which is another reason why we're following and continue to follow that moderate to severe scenario. With the immunization of the populations at higher risk of hospitalization, the ratio between the number of diagnosed cases and the number of hospitalizations is expected to improve in the direction of having fewer people presenting with severe illness. However, some variants offer higher risk of severe outcomes. This counterbalances the effects of immunizations to some degree. And different populations, some who might be younger and healthier, are now expected to require hospital care, which can still challenge the healthcare system's capacity. Next slide. This slide talks about the prevalence of ICU admissions and occupancy. The intensive care unit occupancy numbers are following the severe scenario. On this slide, the circles in black show the number of people in ICU who are infectious. The circles in red show all COVID-19 patients in Manitoba ICUs, both infectious and non-infectious. The green circles show all Manitobans in ICU who have COVID-19 both in and out of the province. In the past few days, the overall number of people in ICU seems to have stabilized. However, it's still an extremely high number, and it isn't sustainable. At this time, the data is telling us that the majority of people in ICU are people who have not gotten the vaccine. This could be for a number of reasons, including access to the vaccine. We are not sharing this information to blame people, but to show the importance and power of getting vaccinated. For example, between June 1st and June 6th, 151 people were admitted to hospital, of which 73% were never vaccinated, and another 7% had one dose of a vaccine and got a COVID infection less than 14 days from their vaccination date. This means 80% of people admitted to the hospital during this week never had immunity to COVID-19. In contrast, only 2.6% of hospital admissions were in those who were vaccinated with 2 doses, and none of those who were fully vaccinated entered the ICU. Those numbers should really stand out to the power of the vaccine and what it means to one's own health, one's family's health, and the community's health. The strain on the healthcare system continues to be severe, and while the numbers seem to have stabilized, the levels are far too high. We need to bring these numbers down to reduce the demands on frontline providers and to ensure non-COVID patients can access the care they need. So please, if you have not already done so, go make your appointment for a vaccine, and when your time comes to make that second appointment, please do so. If you are vaccine hesitant, call your primary care provider or pharmacist or local public health unit and discuss your hesitation with professionals who are there to help you. The same people who help you when you need help with diabetes, high blood pressure, when you present to the hospital for chest pain, when you need a surgery done. These are the same people you should be trusting to get information from for COVID-19 and vaccines. Next slide. So just notes on modeling. The modeling has been updated to include information on immunization and uses actual immunization data from the province when available to make future projections. This is an agent-based model, and there are over 253 variables incorporated into it. The model has also been updated to allow for the B117 variant or the alpha variant to be included. However, the risks and behaviors of the P1 or gamma variant and the B1617 delta variant are not reflected in the model. Work is underway to understand these variants and to include them in future modeling. The current models show us in a moderate position on transmission and a severe position on the ICU prevalence, and that is without factoring in the gamma and delta variants. This is critically important. We know that the Delta variant in particular has the potential to be more transmissible and has more severe impacts in relation to hospitalizations and ICU use. This means that we must continue to watch the Delta variant carefully to make sure we are aware of the possible impacts of this variant in Manitoba. It is precisely why our path to reopening is cautious. If Manitobans continue to get vaccinated as soon as possible, and both first and second dose rates continue to increase, we are likely to win the race between these new variants and the vaccine. Slowing in our progress or failing to adhere to the public health orders in this critical time risks a resurgence of cases and puts our path to one great Manitoba summer at risk. In the meantime, we will continue to update the model as more data becomes available and new evidence comes to light, and we'll share our progress with you. That'll be the end of that presentation. The new public health orders announced Wednesday will take effect Saturday, June 12 at 12:01 a.m. and include provisions for outdoor gatherings with up to 5 people in public spaces and on private property. For private residences outside, you can have up to 5 visitors from no more than 2 other households in addition to those who reside there. This also applies to campsites. For public spaces outside, you can meet up with a total of 5 people. These are the only changes at this time, and all other restrictions remain in place. People are reminded to minimize the number of people they interact with as much as possible during this time. Physical distancing and masks are recommended in outdoor settings for non-household members. While the risk of transmitting COVID-19 in outdoor settings is lower than indoors, transmission can still occur when there is close contact. While we are opening up just a bit, I still encourage you to stay at home as much as possible. We have to keep our numbers of close contacts low. We have to wear masks when we're around others from outside our households, even outside. Everyone must make an appointment to get vaccinated. Right now, it's up to all of us to take the steps to protect each other. It is our collective action, not public health orders, that will bring cases down and help end the third wave in Manitoba. Practice the fundamentals, continue to stay home as much as possible. Before I close, the end of the school year is fast approaching, and I want to extend my congratulations to all the students in Manitoba who are wrapping up their school year. You have overcome not only academic challenges, but also an unprecedented school year due to the pandemic. For those graduating from grade 12, this is usually a time of celebrating with families and friends. Unfortunately, we are not able to celebrate this milestone the way we usually do. Manitoba Education has provided guidance to schools for graduation. For families and friends wanting to honor their graduates, I cannot stress strongly enough that those celebrations need to follow the current public health orders. Celebrate virtually, organize a drive-by parade, or decorate your lawn with signs and balloons. There are a lot of creative ways to celebrate a loved one's academic accomplishments that can be done safely and within the current restrictions. Thank you. I can now open up for questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Colin.
Good afternoon, Dr. Atwal. With test numbers dropping, how likely is it that the COVID situation might appear less severe than it actually is?
So obviously, we've talked about how cases get generated, that lag time that happens before a case presents to a hospital or ICU. Over the past 3 weeks, our trailing average has been declining in case generation. So right now, I think our trailing 7-day average is about 230 cases per day. So that's going down about 20% from its peak about 3 weeks ago. So we're going to hopefully continue to see that decline. We're anticipating that decline as well over the next few weeks. So that'll put us in a much better position in relation to cases. Obviously, with that, we have vaccine that's being rolled out with tens of thousands of doses on a regular basis being delivered every day. And that'll help negate some of the impacts of having some circulating strain as well. But we have to, be aware of that lag time between a case generation and what happens at the hospital or with the hospitalizations or an ICU visit. So right now, our hospital numbers seem to have plateaued. I'm thinking we're going to start to see that a bit of decline right now, but it all depends on behaviors of individuals. Our ICU numbers seem to have plateaued, and I am hoping that we, on a week-to-week basis, see a decline. But those declines won't happen the same way we see case numbers decline. They'll be, on a percentage basis, they'll be much less, probably about 10% per week. So even right now, we have 30 people out of province right now in ICUs outside of Manitoba. Altogether, we sent out 57 individuals. 23 have been repatriated back, and unfortunately, we had 4 deaths in those individuals who were sent out of province. So we still have people out of province. We still have a strain on our ICU here as well. In our ICU, we have 63 Manitobans with COVID, and then we also have that strain on the hospital system with roughly 300 people in hospital. So week by week, we're hoping we see numbers improve, but it won't be drastic improvements. But we are anticipating some improvements there. So it's going to take some time. Again, cases is one thing to drop down. The hospital and ICU numbers will take some time to drop down as well.
Thank you. Regarding the public health orders that come into effect tomorrow, we've had some readers inquire whether the new rules surrounding outdoor gathering mean that they can hold yard sales once again. Is that possible?
So, I guess under the orders, you're allowed up to 5 people from 2 different households outdoors on your property. So if the yard sale is set up, with only allowing 2 different households on your property, I believe that would be allowed. Again, I think for the next couple of weeks, we still need to be cautious about having too many interactions, not just the next couple of weeks, but it's really important for the next couple of weeks. We have a reopening strategy, but that's based on limited interactions still between individuals.
From CJOB, Clay.
Good afternoon, Dr. Atwal. Talking about the changes, the restriction tweaks that come into effect tomorrow, we and some other media had reported yesterday that there was a Winnipeg barber. He had hoped to be able to go into people's backyards this weekend, cut people's hair. But do you want to just stress personal services such as haircuts, going into somebody's backyard and doing their nails? That stuff still is not allowed, correct?
Yes, according to the orders, that would not be allowed at this point.
We're also hearing there could be some more illegal gatherings this weekend, possible anti-mask rallies, etc. Do you have any comment on that?
We're aware of some activities that are being planned. I don't personally follow it too much. I know the enforcement side is well aware of it, and they're going to be addressing that and handling that if anything does happen. I think from a public health perspective, let's be, honest with Manitobans here. Like we are in a dire situation here. Like we have issues related to case generations. We have issues on the acute care side. We're sending people out of province to get care from an ICU perspective. And this occurs because people interact. It occurs, maybe some people don't believe in COVID until, there's examples of this where people present to the hospital being non-believers, and then once they get into intensive care unit, they become a believer. We have professionals all around the world, medical professionals that everyone trusts with. We have patients, my own patients, they trust me with their lives, with diabetes, with high blood pressure. We're all saying COVID is real. We're all saying the hospitals are full of people with COVID. The ICUs are burgeoning at the seams with COVID. So COVID is real. And we understand that this is restrictions on people have an impact. But we need to keep those restrictions on to limit case generation, not to overwhelm the acute care system, which it already has. People are being delayed surgery. So I'd like these individuals who are thinking about not believing in COVID or attending these rallies to really understand the situation. This isn't unique to Manitoba. We're seeing it all around in other jurisdictions. And to, if you choose to protest virtually, protest with a letter. But by gathering, by getting together, we're going to cause more problems with case generation, which will have an impact on our acute care system.
From the Winnipeg Sun, Scott.
Hi, good afternoon to you, Dr. Atwal. What is the message for people who are fully vaccinated, the parents are fully vaccinated, but they're not allowed to gather, but, people can still travel now across, the country. Other people from outside of the province can come in if they're fully vaccinated, but people still can't visit, like, family members, down the street or across the city who are also fully vaccinated.
Yeah, we know from a public health measure standpoint, we're looking at that. Right now, there aren't, not many people have been fully vaccinated. Not many people are 2 weeks out from their second dose. We understand there are situations where what you're describing is there. And we're talking about that from a public health perspective, but we're not ready to go allow that to occur at the present time. So as a household unit, if you do end up leaving the province, our messaging is still stay in the province unless it's essential travel. But as long as you're immunized, fully immunized and 2 weeks out your second dose, that everyone who is in that situation can come back and doesn't have to self-isolate, they just have to self-monitor. So, planning vacations per se right now with other family members in different households, I wouldn't suggest it at the present time. We still have to look at risk here in Manitoba, and we have to look at that from a public health measures perspective. And that's something that will be addressed in the future, and it'll probably be several weeks down the road.
Okay, thanks for that. There was some nurses this morning talking about, major issues regarding contact tracing in terms of call center. They're only there to provide consultation, it appears, and, it's just, in a word, a mess. What is your understanding of contact tracing right now? Where is it at? Is it in trouble at the moment? What are your where do you see that right now?
Yeah, first, I do want to thank all the public health nurses and the public health team for working very hard throughout the entire pandemic. I don't think we've appreciated what all these individuals have been doing and are doing right now. The public health system has been stretched. We always talk about the acute care system, but the public health system has been stretched as well. And that's just not a Manitoba phenomenon. That's in other jurisdictions right across Canada as well. So, we've had people working 7 days a week, 8, 12, 16 hours a day just to keep up. And with that, we actually are having issues, on, let's say, case and contact investigations. We learned that in the second wave. And with the second wave, as case numbers increased, as contacts increased per cases, it was hard for us to get that 24 or 48-hour turnaround time. So like other jurisdictions, we used other resources that we could. So we used resources such as Stats Canada, we used people from the Red Cross, and we also used 24/7 in Manitoba specific to that to help address and be ready for a surge. We wanted to be prepared for surges of 600, 700, 800 cases. So a lot of work went into developing a program, working with public health nursing, working with, service delivery organizations and those leaders. And we have public health nurses involved with this. Public health nurses still do a lot of the case and contact management, and they do what's called the complex cases. The less complex cases can end up with one of these other partners to manage. And when other partners are managing it, there's a continuous quality improvement cycle attached to that as well. So those cases are reviewed, commented on, and we build capacity in those areas as well. Now, there's mistakes that get made. Doctors make mistakes, nurses make mistakes, and people in healthcare fields or who provide services, administrative people make mistakes as well. So we do have processes in place for that, and we're going to continue to work with all those stakeholders, including local public health nursing, to help address those concerns. And, we meet with them regularly, and we meet with the leaders regularly, and we're going to continue to meet them as well to help address any concerns and mitigate any issues that might be there.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. Thanks for these slides here. Just looking at them, though, they're showing where the current numbers for various indicators match up on your various scenarios. But looking ahead, based on everything that you know now, where do you see the average daily case count being in a week, 2 weeks, a month?
Yeah, so right now I believe our 7-day rolling average is 230. I'm anticipating on a week-to-week basis they drop about 20%. In the last 3 weeks, they've dropped anywhere between 20 or 24% on a week-to-week basis. So, 230, take 80% of that. That's where we'd see it probably next Friday, and take another 80% of that to kind of look at the next Friday there afterwards. So that's where I kind of anticipate case numbers going over the next, even 3 weeks' time. Just take 20% off per week starting now, and that would be my anticipation.
Now, assuming that Delta variant growth is, it's starting from a pretty modest place, but it looks like it will be growing faster if what we see in other jurisdictions is accurate here. Even though it's going to be contained by vaccines to some extent, what's public health's plan for the Delta variant 1 month, 2 months down the road if it starts spreading fairly rapidly among the unvaccinated population?
That's a great question. So obviously our modeling hasn't taken into account the Delta variant as of yet because we still have to put those parameters in. So models are going to be created for that as well. There's a Delta variant, there's a Kappa variant as well. So those variants are more transmissible compared to the UK variant, depending on what study you read, 50, 60% more communicable or more transmissible to another person. In relation to severe outcomes, we're still learning some of that information compared to the UK variant or the Alpha variant. It does seem like in small studies from the jurisdictions that have data available that you're more likely to end up in a hospital situation if you end up having a Delta variant as well. But the case numbers are still small, so we're still learning that data as well. What we know on the vaccination side is, vaccinations are effective in preventing even variants of concern. Obviously, we were early on thinking one dose was very effective, up to 80%, let's say, to prevent the Alpha variant or the wild type of COVID infection as well. And with the Delta variant, that number is less with one dose from what we've seen in other jurisdictions. And that number might be 33% less than that. But what we do have from other jurisdictions is a lot of evidence showing that 2 doses is close to 88 or 90% effective in preventing an infection. And that in turn prevents hospitalizations and ICUs stays. So the strategy here is, again, we got to work on getting vaccine doses out. We have a number of Manitobans already vaccinated. We're close to the 1 million dose given. We got 70.6% of Manitobans over 18 with 1 dose and 68.3% with 1 dose as well. The strategy now becomes 2 dosing. So getting that second dose out into arms as quickly as possible as supply comes in to get those doses out. And there's a lot of strategic work being done on the ground to work on vaccine hesitancy if people are hesitant. From access issues, or we're improving and desiring to continue to improve access to vaccine in those populations that are unvaccinated throughout the province for many different reasons. Maybe the inability to get to a super site or access to vaccine. Maybe it's just a lack of knowledge. Maybe it is just making it more easier for them to get the vaccine as well. So a lot of work's going to be done on that as well. We're working with groups as well from different who represent different types of people as well to work on vaccine uptake and vaccine hesitancy, not only for the first dose, but to make sure those second doses come in. So the Delta variant response is we have aggressive case and contact management in place for variants of concern. We were leaders on that across the country. We continue to use that. From an awareness of how much Delta variant is in Manitoba, we have laboratory information related to that. We screen for VOCs. There is no screen yet for the Delta or the Kappa variant. Those are being developed. But if a positive test result doesn't screen in for the Alpha, Beta, or Gamma variant, those are automatically sequenced for sequencing, so we know from an absolute number how much in the Delta variant or the Kappa variant is in Manitoba. So that'll provide us a lot of information on how that spread is. And right now we have seen some community transmission, but most of the cases have been related to households only and some clusters outside of that as well. So we're going to continue to monitor that. And I think from a strategy standpoint, again, case and contact management, we encourage people to limit those interactions, follow the public health orders. If you get sick, get tested, stay at home, self-isolate at home until that test result comes back. If you're positive, work with public health. Work with public health to identify your contacts and to make sure that they self-isolate. You're not going to get in trouble from public health. We're going to work with you to help you self-isolate. So if you need food, we're going to bring you food. If you need a place to stay, we're going to find you a place to stay. If you're worried that your job is on the line, we'll make sure your job isn't on the line. We'll work with you to make sure you self-isolate properly. If for some reason you develop COVID by not adhering to an order, we're not going to ticket you. Just be honest with us, and we're going to work with you to address those issues and to work to identify those contacts as well. And again, when vaccine is available, and it's available right now, book your appointment, get that second dose when your time comes. And if you're hesitant, work with trusted professionals that you trust with your health, with your life in general, and get that information from them.
From the Canadian Press, Steve.
Oh, hi, Dr. Atwal. I noticed just doing my rough math that people are still getting their first doses, but the pace of first dose administration seems to be slowing down. Do you have any data reflecting what level of first dose coverage the province might get to? And that might include the new steps such as, opening up to walk-ins next week at the Layla super site.
Right, so we're just gathering that data. So right now, again, 68.3% of people over the age of 12 have their first dose. 15% over the age of 12 have their second dose. Over 18, that first dose is in 70.6% of arms, and 16.4% of those people have 2 doses as well. So the rate of first dose uptake is lower now, for sure, and the rate of second dose uptake is increasing, just from the sheer numbers of people who already got the vaccine. We're still going to continue to see an increase in vaccine uptake on the first dose. That's what we anticipate to the end of June. I don't have that exact number right in front of me from a projection standpoint, and the vaccine task force might have some better numbers or provide that number to you next week. They have some of those numbers. And we're going to start to see a significant increase in the velocity, in the rate that second doses come out as well. So the strategy here is, again, to get as many people vaccinated for 2 doses as quickly as possible to work with our reopening strategy. And that's, again, we have indicators and parameters based on July 1st or Canada Day, on Terry Fox Day and Labor Day in relation to what we'd like to see from a vaccine uptake from the population to look at what other steps we can do to lessen restrictions on Manitobans.
And the daily case count, as you mentioned, has dropped sharply. The test positivity rate is down, but it's still very high, still well above the 3% that used to trigger quite a bit of worry. What do you attribute that to, and what does it say about the ongoing community spread of the virus?
So, there is obviously ongoing community transmission. We're still generating cases. We know that, most cases are household contact. So once a virus is in a house, likely most individuals within that house, if they're not able to self-isolate properly, will end up as a positive case as well, develop symptoms and get tested. So some of that test positivity is still high, simply because once it's in one person's house, let's say if they have 3 other people or 4 other people in the house, all those people might or typically will end up getting COVID as well. So, with an introduction of one case in a group of 4 or 5, 80% of those people might convert, and that, adds into that test positivity because you're doing a small number of tests in that group as well. I think in general, we're seeing less virus out there. We're seeing less transmission out there, and I think people are adhering to the orders. The behavior changes are there, and I think more people are cognizant of the issues related to the acute care system and are doing their best to limit those interactions with people. And if they are interacting, they are doing it in a manner just specific with their household. And now they're going to have an opportunity starting Saturday to meet with others outdoors. And I want to stress the importance to everyone that we still have to limit those interactions. Don't share meals outdoors. Try to distance outdoors still. Have those conversations with neighbors or friends or family that you might be getting together with on your private residence or in a public space, but try to still keep that distance. It's still imperative that we need to limit our interactions, but we also need the benefit to allow people to interact with each other. It's really good for one's mental health. It is really good for socializing, to have a bit of a stress relief. This has been a stressful time, and we want Manitobans to de-stress, but let's de-stress in a safe way.
From CTV Winnipeg, Stephanie.
Hi there. In the fall, we saw regional closures and regional restrictions when it came to rising COVID cases. Is there any chance we could see regional reopenings? Just some areas, the of Stanley, for instance, only has a vaccine uptake of about 15%. Other areas in the north have over 80%. Could we see that regional reopening approach potentially?
Yeah, anything is on the table. We have lots of tools we can use. We've done some specific in the past based on risk, and I think we'll continue to look at those options in the future. When we look at immunity and we look at vaccine uptake, we can't just have certain areas all vaccinated and other areas not vaccinated. That doesn't provide, the resemblance of herd immunity. That poses risk. So we need to be aware of that. And again, we are promoting vaccines. We're going to work with everyone that we can to work on that vaccine hesitancy. And I encourage everyone in the public to work with your own family members if there's some hesitancy. Encourage them to seek their primary care provider and have discussions with it. I've met some nurses who have, families of 8 siblings, and they're older, and 3 out of 5 are vaccine hesitant or don't believe in COVID. And these are nurses who are providing that information to them. They're going to continue to try to provide that, they've assured me. But there are some challenges there, and there's some challenges with certain individuals throughout the province, and we're going to continue to try to break down those barriers, understand those barriers, and work with populations to address those concerns as well.
And for people in Manitoba who have gotten vaccinated, but they don't have a health card, so for instance, if it's an international student or someone of the like, and are they able to get that immunization card so they can still partake in if they need to travel somewhere and not isolate upon return? Or can you only get that immunization card specifically if you do have a Manitoba health card?
Yeah, so those without a Manitoba health card who have been immunized, they're in Manitoba, they're able to, and without a health card, you'd have to go down to your local public health unit and get a printout of your vaccine records. And that should suffice for any sort of requirements from anyone in relation to vaccination status.
From City News, Mike.
Hey, good afternoon, Dr. Atwal. I just recently jumped off a press conference and joined this one, so forgive me if I ask something that's already been asked. My first question, a few public health nurses came out anonymously this afternoon talking about the contract with 24/7 In Touch. They say that there's been times where the contract tracers have made errors and it's led to critical incidents where maybe a person who should have been isolating for longer doesn't isolate long enough, and they say that has led to transmission in the community. What's your reaction to the nurses coming forth, and, are these alleged issues a real thing?
Yeah, this question was asked earlier. I guess I'll repeat. I mean, we first and foremost, again, I want to thank public health nurses. They have been stretched. We talk about acute care system capacity being stretched, public health nursing capacity. Public health has been stretched right from the beginning of the pandemic. We've worked with other partners. We've seen what other jurisdictions have done with other types of partners to aid in case and contact manage. And we, because of what happened in the second wave with the sheer number of cases that were generated and our inability to, we'll look at 24-hour, 48-hour turnaround times, we looked at other resources to facilitate that. Because we can't create public health nurses in 1 day or 2 days. It takes many years to develop a nurse, and then there's some specialization you have to do for a public health nurse, just like if you want to be an ICU nurse. And if we do expand our nursing portfolio here, what happens is we take nurses away from another part of the acute care system, perhaps, right? So there's some issues there. And we do recognize that, and if our desire would be to continue to work with our parameters and the individuals we always had, but because of an inability to get more of those resources, those specific resources, we had to look at alternatives to aid in case and contact management. So we worked with Stats Canada, we worked with the Canadian Red Cross, and we worked with 24/7. We worked with public health, we worked with medical officers of health, we worked with public health nurses and leadership at the service delivery organization level to create a system where these other individuals can help. And they don't help out with complex cases, they help out with more of the bread and butter, the easier type cases for case and contact management. And within that structure as well, there's a continuous quality improvement component as well. So there are individuals who review those cases to build capacity amongst those individuals as well. And that information is reviewed every day. It's reviewed regularly with all those leaders in those areas representing, public health, representing each one of those stakeholders as well, including public health nursing. So there are errors made. Doctors make errors, nurses make errors, administrative staff make errors, healthcare workers, everyone makes a mistake. There's processes in place here to mitigate those issues, to learn from those issues, to make sure that there isn't a ongoing tendency to make the same mistake. If something is deemed critical, then that is addressed as well. So there's an ongoing work being done on this. A lot of work has been done on it as well. And we're going to continue to do work on it. Again, we meet regularly, and we're going to have regular meetings with public health nurses in relation to this, as well as the leaders of public health nursing.
Thank you for that in-depth answer. My follow-up, I'm sure, has been asked as well, but I have to ask anyways. So the whole point of the press conference was to ask that the contract, or not the whole point, I should say, the contract with 24/7 In Touch does not get renewed this month. Has the province made any decisions on this, or do you have a reaction to that?
I'm not aware of contract statuses. That's not my job, so I don't have any knowledge on that. Sorry.
From CHVN, Taylor.
Hi, good afternoon. Can you just explain why a yard sale with potentially dozens of people an hour is allowed, but not things like outdoor haircuts between masked people or distance and sanitized patios?
Can you just repeat the first part of the question, please?
Yeah, why are yard sales allowed, but not the other things?
Yeah, I mean, the yard sales fall into that order, I think. Again, we've changed the orders. So we need to, have that stop valve there for individuals, a little bit of a pressure release. There are a lot of activities out there that probably could be deemed safe. Again, we aren't messaging do yard sales. We aren't messaging go out and do X, Y, and Z. Have that social outing if you need it, but limit that social outing if you can. Don't interact with, different people on a regular basis, on an hourly basis. That's not the message. The message here is here's a bit of a release valve. Let's play it safe. This allows those interactions to occur outside of your household, outdoors. Limit those interactions still. Like, we are still in a spot here where our acute care system is burdened. And so we need to be cognizant. This isn't to maximize what you can do under the orders. Look at the spirit of the order. The spirit of this is to allow some interaction, some social interaction with others to get that mental health relief for people. That's what this is about.
Thanks. And as you know, we've got graduations coming up. People want to celebrate it likely in the next couple of weeks once July hits. How should people plan for these gathering sizes?
The gathering sizes are what they are right now. So it's a group of 5 outdoors, not from more than 2 different households on your private residence. That includes campsites or cabins. Outdoor public spaces is a group of 5. We've worked with education as well to look at different types of ceremonies that they could possibly do. So that information is with education as well, and we're continue to work with them as well. And those are the rules. So work within those rules. I understand it's challenging. I understand it's a time of celebration. There's a lot of individuals who've worked really hard, and this is that one time to celebrate. If you can delay that celebration, I would delay that celebration. Have a better celebration in August or September than having it right now. If you can do that, if you have that choice, and if you're able to do that, I would make that choice. I know it's challenging, but that is what public health is recommending.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. Apart from encouraging people to get vaccinated and follow public health orders, what does Manitoba need to do now to prepare for a 4th wave?
So a lot of work is being done to prepare for a 4th wave. On the public health side, we over the last several months, obviously we increased our testing capacity. We've increased our case and contact management capacity. We've worked with alternative isolation. We're bringing out vaccines as well. We're promoting vaccines, first doses, second doses. We're looking at bringing more vaccine, readily more available to Manitobans, even remote locations. From an orders perspective, we still have those orders there. From an acute care perspective, a lot of work's been done on the acute care side to build that capacity as well. They're tired right now, I know, but there is a lot of work being done, has been done, and is going to continue to happen over the next few months to keep building that capacity, to build that ICU capacity, to build that hospital capacity, and find ways to, get all those surgeries that were canceled, to try to get some of those back online, the diagnostics as well. So the system isn't stopping here because vaccinations are rolling out. The system's going to continue to work hard. It's going to work hard throughout the summer to look at these sort of rate-limiting issues that we've have. And on the acute care side, that is somewhat of our largest rate-limiting step is our acute care capacity based on personnel. We need to develop more personnel to be able to work in the acute care system to manage not only COVID, but everything else that happens. Our acute care system was busy 20 years ago. It was running probably at 100%, right? It's been running at 100% ever since I've been in medicine. And right now we've had another disease that's added onto it that's very impactful. So we have to, and they have pushed up to try to meet those demands, but to do so in the future will require more personnel, which is what the system is working on.
Okay, thanks for that. I'm wondering about the recent changes to the public health orders that required employers to do some more reporting when cases occurred at the workplace. Do you have any update on that and on the current level of workplace transmission in Manitoba?
I don't have exact numbers there. I know public health has been getting that information and looking at those issues within those workplaces or concerns brought on by multiple cases in a workplace. Again, just because there's 2 or more cases in a workplace doesn't mean that there's workplace transmission, and that's what we find most of the time. So public health is involved, workplace safety and health is involved, and we're going to continue to be involved in those activities and with getting that information and addressing that information. But I don't have any specific numbers for you today.
Our final reporter this afternoon from Global News, Anya.
Good afternoon. When looking at other reopening plans in other, Ontario requires just 60% of people to have a first dose before opening, and for phase 2, it's 70% with 1 dose and just 20% with ours, which is lower than even our first stage of opening. So why are we requiring a significantly higher first and second dose level to open at each stage?
Well, there's differences between the populations. There's differences between where we're at and the third wave as well. Ontario entered the third wave sooner than we did. We're still having the impacts of that third wave as well. We know that Delta variant, we know there's going to be other variants of concern out there outside of Delta, something new that might show up as well that would require more immunizations to be taken in to allow for that quotation marks herd immunity curve to limit the ability for a virus to spread. So, we're taking all that into account. It'll be interesting to see what other jurisdictions do from a planning standpoint as well in relation to the numbers that they've chosen. We chose our numbers later. Their plans were brought out before our plans were brought out for various reasons, especially from, again, we enter that third wave later than other provinces. So the numbers that we've chosen are achievable, we believe. We believe Manitobans have stepped up to the plate to get that vaccine and are going to continue to step up to the plate to get to that second dose as well. And with the scheduling, with the desires of what we want from a public health perspective, we feel that if we can get those vaccine uptakes to those levels, it would help mitigate case generation and again impacts on the acute care system.
Thank you for that. And many kids won't be 2 weeks past second doses if they're 12 or 13 until basically the end of summer. So under current restrictions, there's next to no options for them to do anything. And when we talk about restrictions, we mostly hear things that impact adults. So what can children look forward to this summer in terms of the potential for camps opening or going back to school in the fall?
Yeah, so we're having those discussions right now in public health and what would be available, with our stage 1 reopening or the July 1st reopening strategy and plan. We're finalizing those things right now. We're still going to look at information over the next 1 to 2 weeks' time and base our decisions on not just, vaccine uptake. We're going to have to look at the acute care system, case generation, and risk. And to see where Manitoba is at from a risk perspective. I think over the summer there'll be opportunities for youth to get involved in activities. It may not specifically look like a previous summer, but there will be opportunities there for sure. And the further we go into summer, the greater that opportunity would be there. 12-year-olds have been already getting vaccine, and they had vaccine. Some of them had vaccine a couple of weeks ago already as well. So that allows them that protective effect, and that allow them to get that second dose sooner, obviously. So again, we're looking at all this from a public health perspective, but it's too soon for us to say anything that's finalized. Again, once something is finalized, we'll provide that to the public.
Thank you, Doctor. Thanks, everyone. This concludes our media briefing.